Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is a red blood cell folate test. So let's get started. So before we get into the specifics of the red blood cell folate test itself, let's talk a little bit about what you can expect when your doctor orders a red blood cell folate test for you. So the red blood cell folate test is a simple blood test that can be done at your closest laboratory. No special preparation is needed for the red blood cell folate test, which means you don't have to fast, so you can eat and drink as usual before the test. So during the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into an EDTA or purple top blood tube. This tube is then sent to a laboratory where it is analyzed and resulted. So what is folate and what is a red blood cell folate test? So folate is a water-soluble vitamin of the B complex group, and it is required by the body for optimal health, growth, and development. Folate is naturally present in a wide variety of foods, including vegetables, especially dark green leafy vegetables like spinach, kale, and lettuce, fruit and fruit juices, nuts, beans, peas, seafood, eggs, dairy products, meat, poultry, and grains. So what is a red blood cell folate test? So an RBC or red blood cell folate test measures the amount of folate, which is a type of B vitamin, in your red blood cells. So folate is also known as vitamin B9 and is a crucial vitamin in producing DNA, repairing tissues, and forming healthy red blood cells in our bodies. So let's explore the specific functions of folate a little further. So folate is essential for DNA synthesis and repair. So folate plays a critical role in the production and maintenance of DNA, which is the genetic material in our body's cells. This is especially important during periods of rapid growth, such as during pregnancy and fetal development. So this is why it's so common that pregnant women are always seen to be taking folic acid supplements or folate, or increasing their intake of folate in their diet. So folate is also essential for cell division. So folate is crucial for cell division and growth, making it essential for the production of new cells in our bodies. So it's already involved in two very essential processes, DNA synthesis and repair, and cell division. So we can see how important this vitamin B actually is. Another function of folate is the formation of red blood cells. So folate is necessary for the formation of healthy red blood cells, which carry oxygen throughout the body. And a deficiency in folate can lead to an anemia, which is a condition where the body doesn't have enough red blood cells to cope with the oxygen demands. Another function of folate is homocysteine metabolism. So folate helps in the conversion of homocysteine, which is an amino acid, into methionine, another amino acid, and high levels of homocysteine are associated with increased risk of cardiovascular disease. So now we see how important folate actually is. It helps to prevent cardiovascular disease. It helps to form red blood cells. It's essential for cell division and essential for DNA synthesis and repair. So now let's explore the normal ranges of the red blood cell folate level. So the reference range of the RBC folate level may vary by age, but normal levels are as follows. So in normal healthy adults, we have values of 140 to 628 nanograms per milliliter of blood, or this can also be expressed as 317 to 1422 nanomoles per liter of blood. And in children, we have normal values over 160 nanograms per milliliter of blood, or over 362 nanomoles per liter of blood. So what are the causes of abnormally high red blood cell folate test levels? So high levels of RBC folate can be due to several factors, including number 1, folate supplementation. So taking folate supplements, especially in high doses, can and will increase the red blood cell folate level. Number 2 is dietary intake. So a diet rich in folate, found in leafy green veggies, legumes, and fortified cereals, can also raise the RBC folate level in the blood. At number 3, we have a vitamin B12 deficiency. So sometimes high RBC folate can be seen in patients who are undergoing a compensatory response to a deficiency in vitamin B12, as both these nutrients work hand in hand together in red blood cell production. So this is actually a compensatory mechanism by the body. In cases of vitamin B12, we will see high levels of RBC folate levels. At number 4, we have liver disease. So certain liver conditions can affect folate metabolism and can lead to increased RBC folate levels. So folate is actually stored in the liver, meaning that if the liver is inflamed in conditions like hepatitis or is undergoing a liver cirrhosis, more folate will be released into the bloodstream, causing high red blood cell folate levels. At number 5, we also have certain medications. So some medications may also interfere with folate metabolism and can cause elevated RBC folate levels. So moving along, let's explore some causes for abnormally low red blood cell folate levels. So low levels of RBC folate can be caused by several factors, including number 1, a folate deficiency in diet. So inadequate intake of folate-rich foods like leafy green vegetables, legumes, and fortified cereals can lead to low RBC folate levels. We can also have malabsorption disorders. So in conditions like celiac disease, Crohn's disease, or other GI disorders such as post-surgical interventions that are leading to a malabsorption syndrome, this can impair the absorption of folate, resulting in low red blood cell folate levels. At number 3, we can have an increased folate requirement. So certain conditions, like we mentioned before, such as pregnancy or hemolytic anemias or rapid cell turnover, for example, in cancer patients, can increase the body's need for folate, leading to quick depletions if intake is insufficient. At number 4, we have alcoholism. So chronic alcohol consumption can interfere with folate absorption and metabolism, leading to lower levels of RBC folate levels. At number 5, we have medications. So some drugs like methotrexate or anticonvulsants or certain antibiotics even can inhibit folate absorption or metabolism, causing low RBC folate levels. At number 6, we have a vitamin B12 deficiency. So a deficiency in vitamin B12 can trap folate in a form that isn't usable by the body, effectively reducing its availability despite adequate intake in the diet. So this is another cause for red blood cell folate levels to be abnormally low. And finally, at number 7, we have genetic factors. So certain genetic mutations, such as those affecting the MTHFR gene, can impair folate metabolism, leading to lower RBC folate levels. So as we have just seen, maintaining adequate RBC folate levels is important for a patient's overall health, particularly in pregnant women, individuals with certain medical conditions, and those at risk for cardiovascular diseases or anemia. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this presentation very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community. Take care and have an amazing day further. Bye for now.